Good afternoon. Today I will talk to you about the current situation of PRRT across Canada. So although I've been invited in the past to give conferences for Novartis and Ipsen, I do not have any conflict of interest related to this specific presentation, which objectives are to review the history of PRRT in Canada and then summarize the current availability of PRRT across the country. Here I will do just a brief reminder of what PRRT is, because I'm pretty sure Dr. Probst presented this in the previous presentation. So it's an internal radiotherapy using radio-labeled somatostatin analogs. And as such, it's called a theranostic application because it's a therapy combined with diagnostic imaging. It has been developed in the Netherlands since the mid-90s. First, they use high-dose indium 111 octreotide, which is basically octreoscan, but at much higher dose, which has some good result, but somewhat limited efficacy. And then they also try a more potent radionuclide, yttrium-90, which was a bit more toxic. And over the last 20 years or so, the lutetium-177 octreotate has been considered as the optimal radiopharmaceutical for PRRT. It's also known as lutetium dotatate or the brand name Lutathera. They are all synonyms. And this is an example of a patient who have undergone an indium octreotide scan, an octreoscan, and a gallium-68 octreotate PET scan, which is a net spot, basically. And you can see that the gallium PET depicts much more clearly the extent of the disease, in particular the bone lesions. And this patient then was treated with PRRT, and we can do scans after the treatment, like the one in the middle, showing where the treatment has gone. And despite it's a bit more fuzzy than the PET scan, it's similar in texture to the octreoscan, but still we can see that the treatment went in all the tumor in the liver and in the bones. So that's where the theranostic concept comes from, a treatment that can be imaged. Now, a brief history of PRRT in Canada. There has been 3 pioneer centers that have been providing PRRT in Canada since, believe it or not, 1998. And the first center was London Health Sciences Center. In 1998, they started to offer the first compound for PRRT, which was indium octreotide. And then they switched to lutetium octreotate in 2011. And from now, that was just a parenthesis to highlight the fact that London started quite a while ago, but from now on, we'll only talk about lutetium octreotate PRRT. And speaking of this, the Cross Cancer Institute in Edmonton was the first to offer the lutetium octreotate PRRT in 2010, followed by London, and then by us in 2012 in Quebec City. There's also been a consortium organized by Cancer Care Ontario, regrouping 4 centers, and they run a clinical trial in 2016, and we'll talk about that also. So first, let's come back to the Cross Cancer Institute in Edmonton. So they started in 2010 to give PRRT under the Special Access Program, and they treated about 300 patients until 2014, when they started their own clinical trial of PRRT, with the particularity that there was it's given with a maintenance regimen, and it's still ongoing. It is set to recruit 500 patients, and they think that will run, they will recruit until 2028 or so, approximately, that they would have been treating 350 patients or so. I don't have the exact number so far from all the provinces. They accept patients with all types of neuroendocrine tumors, and their protocol consists of 4 initial cycles that we call induction cycles of a slightly lesser dosage than the Lutathera at 150 millicurie every 3 months. And then they continue to give PRRT for up to 5 years by giving up to 8 maintenance cycles of a lower dose, 100 millicuries, every 6 months. The London Health Sciences Centre also started with PRRT under the Special Access Program, and in 2014 they also started their own clinical trial, which is very similar, if not identical, to that in Edmonton. They were set to recruit 200 patients. I don't know exactly how many they have recruited, but what I've been confirmed is that the trial is now closed for accrual. They were accepting all types of neuroendocrine tumor, like I said, same protocol as Edmonton. But the good things that we need to acknowledge is that they published very promising results of their initial results this year. And in particular, those patients with NET from the midgut had a progression-free survival of 4 years, which is markedly longer than what was obtained during the NETTER-1 trial with Lutathera of 28 months. And that's possibly, that might be owing to the maintenance regime. From 2016 to 2020, they joined the CCO trial, and would present this in 2 slides. And since 2020, they are offering Lutathera branded PRRT. Then our center in Quebec City, Quebec Universal Laval, we offered PRRT from 2012 to 2016 under the Special Access Program to 37 patients. And then we started our own clinical trial of personalized PRRT, so a different approach than the other centers we presented so far. We have treated under that trial 237 patients, of whom about 1/3 were from outside of Quebec, and most of them, the vast majority, were funded by their province. We accept patients with all types of neuroendocrine tumors. And in our personalized protocol, what we mean by personalizing the PRRT is that we adjust the dose or the activity that we give to each patient based according to what we call dosimetry. That's the study of how the treatment distributes in the body based on the post-treatment scans. So then we made further adjustment for the upcoming treatments. And although we start with 4 initial cycles, we do allow retreatment beyond 4 cycles whenever patients relapse. It can be many months to a few years after their initial course, and we can treat them again. So, also we were the only Canadian center to participate in a pharma trial of another PRRT compound based on lutetium, but another molecule, and that was run and supported by Ipsen, and it's now closed. And since 2020, we are also offering Lutathera branded PRRT, and that's ongoing. So basically at our center, patients do have the choice to participate in our personalized PRRT trial or to receive the standard of care Lutathera regime without participating in any research. A word about the Cancer Care Ontario clinical trial that was run from, they were recruiting from 2016 to 2020, end of last year. It's now closed for recruitment, but some patients are continuing to be treated and followed. And they treated nearly 200 Ontarian patients with neuroendocrine tumor of all types. And the protocol was actually very similar to ours, and I can disclose that I've been involved in the design of their clinical protocol, in which the PRRT was adjusted according to dosimetry like us, although with the difference that they limited the total number of cycles to 4, so no retreatment possible, and also limited the activity to no more than 300 millicurie per cycles. Now, the current status of Lutathera in Canada. Just a quick reminder that it's the very same lutetium-177 octreotate or dotatate that has been used in Europe since early 2000. It's marketed by a company called Advanced Accelerator Application. We call it AAA as an acronym, and it's owned by the big pharma Novartis. And they marketed it following the results, amazing results from the NETTER-1 trial, which I'm pretty sure Dr. Probst would have presented in the previous presentation. And their regime consists of 4 cycles of 200 millicurie of that compound. And just an overview of how drugs are made available in our country. The first step is really to get the Health Canada approval. And that's a federal institution, of course. And that means that after that, Lutathera can be sold in Canada, but it doesn't tell who will pay for it. The next step is to get approved for funding by provinces, because it's in Canada, it's the provinces who fund the health services. And there are 2 institutions, one in Quebec called INES, and one which is a consortium of all other provinces, which is called PCORDER, that study the application and make recommendation to the provincial health ministries. In the case of the INES, they recommended funding for all gastroenteropancreatic nets. We call that GEP nets also, which includes not only the mid-gut, but neuroendocrine tumor from anywhere in the bowel and intestine, stomach, rectum, and pancreas. And there are quite a few patients with pancreatic net. While PCORDER only recommended funding for mid-gut nets. So, and then the next step was for each province to authorize the funding of Lutathera. And so far, 4 provinces, Nova Scotia, Quebec, Ontario, and British Columbia, have announced that they fund Lutathera. And you can see the list of the centers already making available Lutathera. A quick word on the NETTER-2 trial, which is a clinical trial sponsored by AAA Novartis, which is an international study, and 4 Canadian centers are participating. It's for patients with GEP nets from anywhere in the intestine or pancreas at initial diagnosis, so within 6 months from diagnosis, that are untreated or they have been treated for a very short while. They are inoperable, because surgery is still the best option to offer when it's possible, and patients with a higher grade net, such as grade 2 or 3, and they are randomized to receive either the PRRT or a higher dose than the standard dose of Sandostatin LAR with crossover, meaning then all patients would ultimately have access to the PRRT. Here's the map of PRRT in Canada as it was back in 2012, with only 3 centers offering PRRT. And now, as of today, PRRT is available in 7 Canadian cities. And this table summarizes the centers that are offering PRRT. The vast majority are offering it as Lutathera. And there are 4 centers participating in the NETTER-2 trial, which is us in Quebec City, Sunnybrook in Toronto, London, and Vancouver. And there are still 2 hospital-supported trials that are still open, ours with personalized PRRT, and that in Edmonton, who offer PRRT with a maintenance phase. There are still some challenges regarding access to PRRT. First, there's still a limitation in terms of access for about 2/3 of patients, because public funding is only for mid-gut in all provinces except Quebec, and that represents 35 to 40% of patients. So for patients with pancreatic nets or nets from elsewhere, they may be covered by their private insurance, these patients can be referred to Quebec City or Edmonton. And the Novartis has a compassionate access program, although I don't have the details of this. This is usually the doctor of the patient that asks the company to give the treatment if it's not falling in a funded indication. The geographical coverage is quite improving, as we just mentioned, but it will likely remain limited to large centers because expertise is needed. So in conclusion, PRRT is, as you know, one of the most effective palliative treatment for progressive or symptomatic NETs. It has been offered in Canada since 2010 with 3 pioneer centers. And now today, there's a much wider access to because of Lutathera across Canada. There are still limitations in terms of access for patients with non-midgut NETs, but the good news is that there are some options available, including participation in hospital-supported clinical trials. And I would conclude with this, with its unique theranostic approach, nuclear medicine is more than ever critical for the optimal care of patients with NET. So I thank you for your attention, and I'll be available for answering your questions during the Q&A sessions. Thank you.